Hello and welcome to HealthLine. Thanks so much for joining us tonight. I'm Jennifer Blomquist. I have the privilege of hosting the program this evening. If you're one of our regulars, you kind of know the routine, but if you're new to our show, I just want to guarantee you that you will learn something tonight. It's a great way to get some free medical advice. Maybe you have a question about yourself that you want to ask our guest tonight, or maybe it's a loved one or a friend or somebody. We're doing an orthopedic program tonight. In particular, we're focusing on issues of the knee. We're going to be talking about ACL tears and all kinds of options and treatment and so forth. So that's why we keep that phone number up at the bottom of the screen throughout the show. It's 969-2720. It is a toll-free call if you're outside of Fort Wayne. Just put an 866 in front of there. You have two options when you call in. You can ask the question live. They don't just throw you on the air. You will talk to a very nice call screener first, and then we will take your call live during the show. I like that option because the doctor might need to ask you some more questions to be able to give you a better answer. But I understand if you'd rather just give the call screener the question and then I'll ask it for you. That's another way to get your information. So just want to make you aware of your options. And in the meantime, we'll go ahead and introduce you to our guest, a new guest, just brand new to Fort Wayne, actually. So we appreciate him joining us. This is Dr. Daniel Andersen, and he is a sports surgeon. And next to him is an anatomical knee. Yep. So we're going to be using that during the show to show you exactly what he's talking about. So thank you so much.
Thanks for having me. I'm excited.
Well, I was glad you picked out the topic of ACL tears, because I imagine pretty much everyone out there watching says, oh yeah, I know, so-and-so in my family had an ACL tear, or my child did. But I know I couldn't point to the knee and show you. I know kind of what it is, but I don't know where or what exactly happened. So can we start there and just explain that much?
Yeah, well, it's kind of brief overview. The ACL tear is like kind of a buzzword. If you watch the NFL on Sunday, you'll hear, he tore his ACL. What does that mean? So, the ACL is a really important ligament in the knee. It's a really important stabilizer for the knee. So here's our knee here. The front of it has your patella and the patellar tendon, so we'll kind of move that out of the way here.
Okay.
And as you look in the front of the knee, there's this main ligament going right up into the middle of it, and that is your ACL, or the anterior cruciate ligament.
Okay.
There's a PCL, there's MCL, LCL, but we love using letters in orthopedics to name things because it just shortens it. But the main role of the ACL is to keep the stability of your knee, specifically keeping the tibia or the shin bone from shifting forward. Okay. And that plays a pivotal role when we are talking about athletics, sporting, any sort of high level activity. Okay. The ACL can tear in a number of different ways. There's non-contact injuries, so anything where you land awkwardly and you feel a pop in your knee, you feel it shift, you feel it move, that could be a sign that the ACL tore. There's also contact injuries. If you have your foot planted and, somebody runs into your knee, all of a sudden your knee tries to shift on it. The last thing holding on might be that ACL. And so unfortunately, that's when that can sometimes go out on you.
Do you normally hear a pop? No one in my family's had this, but I imagine it would hurt.
I have not torn my ACLs luckily yet. Typically, the patients say that they feel a pop. Oh, okay. I think I've heard somebody say they heard it, but it's usually this, I stepped wrong, my knee shifted, I felt a pop and I went down. Okay. And then they're just like, I don't know what happened. It's weird. And a lot of times they can get up and walk on it.
I was going to ask if you could put weight on it.
Yeah.
You can.
So that's the weird thing. It's, it feels weird. You injured it, and there's a lot of other injuries that can go along with the ACL, but a lot of times you can get up and walk on it, and then but you just kind of know something's wrong. That's usually what a lot of my athletes and patients will tell me. It's just like something happened. This is not quite right.
So what do you do if this happens? Do you have to do an MRI or some type of I imagine X-ray won't show it because it's soft tissue. But...
Yeah, so the typical progression is, you go and get it checked out. Always start with an X-ray because there's a lot of different things that can go wrong when you tear your ACL. You can injure other ligaments. You can even injure the bones with more severe injuries. So X-rays are always the start. Sure. But you're dead on. An MRI really shows all the soft tissues of the knee. Okay. And a really important point to that MRI is that it can show us if there's any tearing in the meniscus as well.
Yeah, that's another. We've done some programs on that
I'm sure we have, but we can go back to the model. Yeah. The meniscus are these little pieces of cartilage in between the two bones, and they kind of act like a shock absorber in the knee. That's the best way I like to describe them. they help disperse the forces out when we're walking. When your ACL tears, there's only a few other structures trying to keep your knee together from really having something bad happen. And sometimes the meniscus gets in the way and can tear as well.
Oh, you can have both at the same time. Because I've heard of people, though, just having a meniscus tear and not the ACL. But so, you know, if that's the issue, if you've got the ACL tear, let's just start with that. What are your options at that point? And does it depend on your age even, what you do?
Great question. And the short answer is I never like to use an age to tell someone they can or cannot have surgery. I think age is just a number.
Sure.
I really like to look at the patient overall and see, you know, how active are you? Are you out there running 5Ks? Are you hiking mountains? Are you staying fit? Is that important to your life? Because that'll help us determine what to do with this ACL. In general, though, the major overall consensus is surgery for this. And that's usually in the form of an ACL reconstruction, which we can get into in a minute. But I would say the main reason that we talk about surgery is not just so you can walk again or play sports, but it's what can happen without an ACL.
Yeah.
So,
like, I didn't know, are there cases where you leave it alone?
Yeah,
and
there
like,
are.
What would be the criteria for that?
The big risk of not doing an ACL surgery is basically further damage and deterioration to your knee.
Okay.
As you go about your normal life and as you start to walk and live your life without the ACL, you really develop a high risk of developing arthritis. And that's the big scary word that we like to not talk
nobody
about.
Wants that.
My joint replacement colleagues would love to hear more about that, but my job is to help prevent that. So what we know in our studies is that probably up to half of people develop significant moderate to severe arthritis just 15 years without having an ACL.
Oh, wow.
So if you're 25 years old and you tear your ACL and you're like, well, I'm done with high school sports, I'm done with college sports, I don't need surgery. I mean, our studies will say by the time you're 40, you might be developing some arthritis. And that's hard to come back from because we can't really reverse that right now.
Can you prolong this? I didn't mean to interrupt you, but like, if maybe that was somebody's mindset, you know, they're 25, maybe a couple of years down the road, they rethink it. Is there a window of opportunity where you have to say it's too late? Or?
Yes and no.
Okay.
Because the arthritis can set in, but I don't like to think of it as like it's too late.
Okay.
Until to the point where it's like very obviously that even if we gave them a stable knee, there's so much arthritis that there's not many great options. But if we get to it before the arthritis sets in, I would say it's not too late.
Okay.
But yeah, going back to the half of patients, if you even go out to 25 years out from the injury, 90 to 95% of patients have arthritis at that point.
Do they? So it's just something that I would, I mean, percentage-wise, would you say definitely more than half probably get the surgery?
I would say
right after?
More than 90% of people end up getting surgery. Yeah.
Okay, wow.
The most common time I see somebody come in who has an ACL injury, but it's like chronic or not had just occurred, is when they didn't really know.
Oh, well,
or they never got it checked out. So I think that's an important thing. If you're playing a sport, playing basketball, doing anything active, and you feel a pop in your knee and it swells up on you, go get it checked out. Because
I was going to say,
it's never wrong to get it checked out.
Yeah, and it's funny. I know your children are much younger than mine, but with my own children, and even when I was a kid, it was always like, we'll just put some ice on it, you'll be okay.
Right.
Because it used to be such a big deal to go to the emergency room, but now we have all these walk-in clinics that are specifically for orthopedics, so I mean, that's just commonplace, I think, everywhere. And I can tell you, it's a totally different experience than waiting like 3 and 4 hours in an emergency room. So if that gives you, because I know a lot of people are, you know, even for themselves, they'll say, well, I'll just wait it out. And it's so much easier now than it used to be years ago to get it quickly checked.
For sure. I have patients getting into my office 3 days after an injury.
Yeah.
They'll feel pop, they go to the urgent care, they get an x-ray, they get them to my office. So it can happen pretty seamlessly right now.
Right, yeah. Well, and with, you know, and sometimes with kids, they don't tell you either right away because they know that it will take them out of their sport. So you gotta.
That's a big concern is missing time.
Right. I think, don't they call that FOMO, fear of missing out? I feel kind of cool. That's like young kids jargon. So, I just want to touch briefly. I know we're focusing on the ACL, but the meniscus.
Yeah.
if that tears as well, is that something that you pretty much just need to get fixed right away?
Yeah, so if you have a meniscus tear with your ACL tear, that's definitely something that we would just take care of at the same time as surgery.
Okay.
You know, here, I'll kind of tilt it so you can see it.
Does it tend to tear like down the front or like across?
You know,
like,
it kind of just depends. A lot of times it's in the back.
Oh, is it? Okay.
And, you know, the goal with a meniscus tear, especially in younger athletes, is to repair it.
Yeah.
So we want to keep your normal meniscus as normal as possible, put it back to where it belongs. You know, there are certain tears where repairing is not really like possible, and those are the ones where we might have to trim away part of the tear. But you know, if we're going in to do surgery on the ACL, we kind of just take care of everything all at once, right there.
Okay. We were going to keep talking about this, but I don't want to forget to remind you to call in, because we only have Dr. Andersen with us until a little before 8 o'clock. And what tends to happen is people wait toward the end of the show, and sometimes we get backed up with the calls. So we don't have anyone waiting right now, so feel free to give us a call. It's 969-2720. It's right at the bottom of the screen. And again, if you're outside of Fort Wayne, it still is a free call as long as you put an 866 in front of there. And, you know, maybe you have a concern about an old injury or about something, you know, regarding your kids or your grandkids. So please give us a call. So what exactly does the surgery entail? Is it kind of an outpatient for the most part?
Yep, it's an outpatient surgery. You come and go home the same day. How long it takes obviously varies depending on how much work there is to do. Are there other injuries? But anywhere from an hour to 2 hours, somewhere in that ballpark.
Pretty quick.
Yeah.
Just numb it locally? Is that?
Sometimes some anesthesiologists will do a block in the leg, which basically makes the whole thing go numb.
Sure.
Some facilities may do like spinals to help kind of control the pain.
Yeah.
But yeah.
All right. So when you're in there, then are you putting any type of replacement material, or are you just working with what's there and repairing it?
Great question. So ACL surgery, the vast majority of them are called ACL reconstruction. And what that means is we actually give you a new ligament.
Oh, all right.
ACL repairs, which would be taking your ligament and trying to have it heal back to itself.
Yeah.
It's becoming a little bit more of a hot topic. I think there's some role for it, but overall, I would say the gold standard for this is to reconstruct the ligament.
Okay.
And the way we do that, there's a whole lot of different options. We call them graft options.
Yeah.
And kind of just looking at it from a over-top view, you can either get the graft from yourself, which we call autograft. So that's taking your own tissue from somewhere else and reconstructing the ACL with it.
Okay.
Or taking donated tissue, which we call allograft. I would say in my younger athletes, more active people, using your own tissue is a lot better. It incorporates quicker and it incorporates stronger. And it's definitely the preferred method for a lot of ACL reconstructions.
Can I ask where you would get the tissue from? Do you have options?
We do, and we actually have some of them here, ironically, right on the knee. One great option is what's called the bone tendon bone graft.
Okay.
So that's kind of an interesting one because it takes a piece of bone from the patella, the center portion of your patellar tendon, and then a piece of bone from down here on your tibia.
Wow, okay.
And we take that, we harvest it, and then we basically recreate your ACL by creating sockets in the bone and filling that in. So then the central portion of your patellar tendon becomes the new ACL, and the two bone plugs go into the sockets to get good bone-to-bone healing.
And you do that all at one time?
All at once, yeah.
Okay.
All part of the same surgery.
I didn't know if it was more painful. When you said, I was surprised when you said kids, because I, would be good candidates for that, because it's a little more invasive. It sounds like it's a little more invasive than if you were to use, a donated material.
For sure. Yeah, that's a good consideration is the pain from getting the graft.
Yeah.
But there's other options. Some surgeons like to take the portion of the quadriceps tendon, so that's like an all soft tissue graft. It doesn't have any bone on it.
Okay.
You can also take the hamstring tendons, another soft tissue graft. So we have lots of options for any sort of different reasons why you would pick it.
Okay. All right. Well, I want to remind everybody, I think we had a couple people calling in. There's somebody I'm going to ask her question, but just a reminder, go ahead and give us a call anytime. Please feel free. We'd love for you to interrupt us. Yeah. As interesting as this is, we want to take your calls. So, Dr. Andersen, somebody named Jenny called. She wanted to know how our ACL and MCL surgeries, how far have they come in the last 20 years, and what about recovery times?
Sure.
Has that changed? Because if you used to have an orthopedic surgery years ago, you were in the hospital.
Yeah, overnight. People used to stay overnight all the time, even for ACL surgeries.
Right.
So that part of the process has become way better, and that's a team effort. That's not just the surgeon. That's the anesthesiologist, the pre-op nurses, the PACU nurses, everyone basically making it where it's a safe time to get in, get out, and recover at home, because we know that people recover better in their own home.
Yeah.
I would say ACL surgeries overall in the last 20 years, I think have been getting a lot better. Our techniques have gotten better. The graft options that we have are becoming more streamlined and slick. And we're learning a lot more about just the recovery process in general to make it better, because we're getting more data. The more that people are tearing their ACLs, the more data we have, the better decisions we can make as surgeons.
Yeah, like how soon after the surgery are most people able to put weight on it?
Yeah.
And what do you put, I mean, I don't even know, do you bandage it?
Yeah.
Or are they on crutches, or what do you normally do?
So for the vast majority of mine from experience is I have you weight bearing is tolerated right away. So you can put weight on it.
Wow, okay.
That doesn't mean you go and play soccer the next day, of course.
Right.
But you're up with crutches and you're walking with it. And I have people in a brace for a few weeks.
Okay.
The brace at first is kind of locked an extension just to protect everything.
Okay.
But you get started in therapy that week.
I was going to say physical, I would imagine
Physical
there's got to be
therapy
physical therapy
is more
afterward.
important than the surgery, in my opinion.
Okay.
That is the key to recovery, is doing good therapy, having a good therapist, which luckily we have a lot of great therapy locations around the city.
I was going to say, that's another thing that's changed dramatically, I would say, in the last 20 years, is it used to be hard to find a physical therapist. Now there's like one on every corner.
I know.
And honestly, you know, we've needed it in our family, and it actually can be kind of fun. I know that doesn't sound, but they do a lot to try and make it fun. They, you know, they
like little
play different
games.
music. Yeah, they have jokes, and actually, physical therapists, maybe they make a lot of money. I don't know, but they're very happy people. I've never met anybody at the physical therapy office who's not really an outgoing, happy person.
Yeah.
So.
But I guess getting back into the recovery timeline and everything, you know, the big question everyone asks is, I tore my ACL, when can I play?
Yeah.
When do I get back to my
sure.
sport?
The young people want that.
It's a hard question to answer with one number. The range is anywhere from 7 to 9 months.
Is it that long?
So it's a long time.
And that doesn't does that matter whether you have the reconstructive or?
Not really. It's kind of the same. The repair or the reconstruction. In general, you're looking at 7 to 9 months.
Wow, I didn't realize it was that long.
Which is why classically we say, well, your season's over. And you know, it's a hard thing to tell a 16-year-old whose life is football or volleyball or soccer, and you're like, I'm sorry, but you tore your ACL, and it's not a fun conversation.
But sometimes it's an incentive. I think there's, isn't it like hashtag come back stronger? You know, I mean, make that your incentive.
The recovery, it's all good. The whole process though takes that long, but that doesn't mean you're not doing things and getting ready to return.
Okay.
You know, you're in that brace for a little bit. You're working on just your motion. That's the first thing we need to get back after the surgery, and then you start to strengthen the leg.
Yeah.
At about 4 months, you're already in therapy working on like plyometric work and jogging and things like that. So you're getting ready.
So you're not just sitting for 7 months.
You're not allowed to just sit around. No way.
No, that's true.
And then really the last thing to come back is the connection between your mind and your knee.
Oh, really?
The psychological component, I think, is really undervalued.
Okay. And that, but usually most people are, I mean, does it require follow-up after that, or are you pretty much done usually? After
you get like cleared?
Yeah.
I mean, as long as everything's good, you're good to go.
All right.
But it's that final step where if the patient or the athlete, you know, they're like, they know their knee's ready. They know they've passed all the tests, but they're like afraid to step on the field.
Sure, yeah.
So there's like sports psychology. There's this whole great movement, and I think that's another big progression that has been made lately in the last 20 years, going back to that question where we have a lot of resources to help athletes say, I'm ready to get back. Your knee's ready to get back. Let's do it.
Yeah. Yeah, it's interesting you brought up the psychology, because I have heard of that, and I've met a lot of kids, high school and college, that have needed that. So.
Yeah.
We talked, Dr. Andersen, we did have somebody else call in and wanted to ask you a question. Larry said that he had knee replacement surgery years ago, but says it popped a week after and it still hurts, and he's wondering, would that be his ACL or?
Probably not.
Okay.
And the reason for that is because of knee replacements take out the ACL.
Oh, they do?
That's part of what they do to replace your knee. Your ACL gets taken out with the surgery to get ready for the implants with the metal and plastic.
Okay. So
a pop after a knee replacement could be a lot of different things.
Sure.
your PCL sometimes is spared, which is the ligament right behind the ACL, which is another important stabilizer.
Okay.
So it could have been that. It could have been your MCL, which is on the inside part of your knee. So it could have been a lot of different things, but I don't think it was the ACL.
Okay. Well, I would say Larry maybe should follow up
Yeah,
with the surgeon
absolutely.
that you saw before.
Yeah, if it still hurts, if you felt a pop,
Yeah.
go get it checked out. Maybe there's something we can do for you.
For sure. All right. We just have 5 minutes left, but that is plenty of time to take a question or two. So I don't want to dissuade anybody from giving us a holler. 969-2720. We're keeping those phone lines open as we continue our conversation. Does it ever do you think that somebody is at a greater chance, I guess, after having this surgery of having it be injured again, or I guess at greater risk of tearing? Because I could see psychologically where that would kind of freak you out.
Yeah.
So.
I would say yes. I think overall, there's always that chance of re-tearing, which is a really unfortunate situation to be in when you had an ACL surgery and it tears again.
Could that happen soon, like after going back into your
Yeah.
activity? It can't. I didn't know if it was
definitely
something that
can.
usually doesn't happen until further down the road.
No, it can happen. I mean, unfortunately, I've seen it happen. They do the whole recovery. They're 2 months back into their sport and it happens again.
Happens again. That would just be devastating,
Yeah,
I would think.
It would be. That's not. Yeah, it's not no good.
So what, do you do anything differently if it's a repeat tear?
Yeah. So ACL revision surgery. That's
Okay.
basically, you have to do it again. And there's a lot of factors that go into that. Like the graft choice that you chose, you can't choose it again because you already chose it once.
Removed it. Okay.
So you maybe have to go to the other leg and get a graft from
Think
the
about
other
that.
side, or pick a different graft. And then you really have to take a good look at how the graft was fixed in the original surgery and kind of determine, is everything in a good spot? Was it technically sound the first time? Is that the reason why it failed, or is it just unlucky?
Yeah, that would just be.
So those are
rough.
long conversations in the clinic with a whole group decision on what we can do to help and make it better.
So somebody in that situation, are they pretty much not cleared to do a sport again? Would it have to be something
tears
really low
again?
impact? Yeah, I mean, are
Yeah.
you kind of done at that point?
Yeah, well, no, you can get back.
You could.
You can do the whole
Oh,
recovery again.
gosh.
I've seen it.
Really?
Yeah, people have really incredible drive, and
Yeah. I could
if
see.
you want to get back, you're going to get back.
Okay. Yeah, I didn't know at that point if it was recommended you discontinue
No.
that certain sport or something.
Yeah.
But
Well, that might be the recommendation from the parent, but
yes, as a parent, I would say I think we're done.
Yeah.
But we were talking about before the show. Sports is a huge part of our culture.
Big
It
time.
really is, and that's probably why it's so devastating for kids when, like we said, we made fun of fear of missing out, but it's a real thing. Even
It's their
I've
life.
seen even for elementary school kids. I don't know if you have any advice for parents. Because you were just saying how you see so
Yeah.
many young kids. It's a sport is year round now.
Yeah.
They're doing one sport all year.
yeah,
So,
I mean, talking about that, my best advice is play different sports.
yeah.
Football, soccer, basketball, track, the different training methods and the different muscles and tendons that you use is only good for your body.
Yeah.
Doing the same thing all year round puts the same repetitive stress on your tendons. That can lead to chronic overuse and injuries.
All right. Good advice. Let's see if we can quickly squeeze in a live question,
Sure.
actually. I believe, Mike, are you still on the line? Hi, Mike. Can you hear me?
Yes, I can.
Oh, hi there. Go ahead. We've got a couple minutes. Go ahead quickly with your question.
Yeah, the doctor made a comment about on knee replacement, you lose your ACL. My question to him would be, on a unicompartmental knee replacement, a partial on the inside, is that still true?
So usually with the unicompartmental knee replacements or partial knees,
Oh,
the
okay.
ACL is still there.
Oh,
so
it
that
is?
is
Okay.
different.
All
Yeah,
right.
that's an important distinction for sure.
I guess, yeah, you usually hear people just getting the whole knee replaced,
Yeah.
but is partial kind of common as well, or?
I think it's becoming more common. Yeah.
Okay.
In the right patient who has arthritis on only one part of the knee, it's a great option, and it keeps the knee as native as possible, keeping your ACL, keeping your PCL, keeping everything there. So,
Okay.
yeah.
All right, interesting. Thank you, Mike, for your question. Thank you to Larry, Jenny. I appreciate all the questions tonight. Thank you so much to Dr. Andersen.
Thank you.
The model was a huge help.
Yeah,
I really
good.
appreciated you bringing that in. So thank you again. I want to remind you that we have another HealthLine 1 week from tonight. Mark Evans will be hosting, and I hope you will join him then. He'll have another guest live during the show that you can ask questions. I'm not sure if they've decided on the topic yet. that's above my pay grade, but you'll find out soon. They'll be advertising it through the week. So thanks again to Dr. Daniel Andersen. I'm Jennifer Blomquist for HealthLine. Take care and have a great night. We'll see you next Tuesday.